Okay, Bismillah ar-Rahman ar-Rahim. It is our pleasure to start today with our, I would say, sixth group for the VIVA, the Project Defense, under the course document, Doc 913. Today we will have our first doctorate student, Soumaiacharif, and as we used to do, Soumaya will have 15 minutes, then the main examiner, in her case will be Dr. Noha Nijim, will take another 15 minutes, then Dr. Asim as a committee member and myself as a mentor. Let me also thank my colleagues, Dr. Asim and Dr. Noha, for being with us. It's our honor to have them as the examining board. From what I've noticed in the last discussions so many times with different students, I feel this is one of the best examining boards that I've ever come across, and I thank them for their effort, dedication, follow-up, and the good directives that they give the doctorate students in order to make the work up to standards. Thanks all, and I'll give the floor to Soumaya for 15 minutes. Go ahead, Soumaya.
السلام عليكم. الحمد لله رب العالمين والصلاة والسلام على أشرف الخلق والمرسلين سيدنا محمد خاتم الأنبياء والمرسلين. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. بداية أوجه خالص الدعاء لأهلنا في غزة نصرهم الله وثبت أقدامهم ورحم شهدائهم دكتورنا العزيز إسماعيل أبو سعدة وجميع شهدائنا الأبرار، وأتقدم بالشكر والعرفان لمدرسينا الأفاضل لجنة المناقشة البروفيسور زاهر كحيل، دكتور عاصم الحاج والدكتورة نهى نجم. I am soumaiacharif. I hold a master's degree in clinical pharmacy and work as the head of medical supplies department in gynecology and pediatrics hospital in Mafraq, Jordan. Today I will present to you my dissertation entitled The Importance of Decision Making in Primary Care Pharmacy Practice. It's an approach in Jordanian community pharmacies in order to fulfill my doctorate degree in management in the International American University. Good morning, everybody, and I will start my, my dissertation. Okay, what is community pharmacies? Community pharmacies or chain pharmacies or operated by pharmacists are the main pharmaceutical institutions in Jordan that provide medications to the public, prescription and over-the-counter drugs, cosmetics and skincare products and medical instruments. Regarding the problem statement of this study, community pharmacists in Jordan have undervalued counseling and decision-making roles. And also the second problem statement is inadequacy in Jordanian pharmacies regarding patient guidance, documentation, provision of pharmaceutical care. The objective of this study is to evaluate the impact of pharmacist-led counseling interventions and enhance decision-making skills on pharmaceutical care, prescription management, and patient care. So, and the research goals of this study are to improve pharmacist-patient relationships, to enhance decision-making strategies, and to optimize healthcare outcomes in community pharmacy settings in Jordan. Research questions of this study, the first one was, what is the impact of pharmacist-led counseling intervention on medication adherence, prescription management, patient care in Jordanian community pharmacies? The second question, what is the impact of pharmacist-led counseling interventions on overall health outcomes in Jordanian community pharmacies? The third question, what is the impact of decision-making skills on medication adherence, prescription management, patient care in Jordanian community pharmacies? The fourth question, what impact of decision-making skills on overall health outcomes in Jordanian community pharmacies? The last question is there is a need for additional training or education on shared decision-making in pharmacy? Regarding the study model of this study, I want to study the effect of additional training and education on improving decision-making process in pharmacy, the effect of improving decision-making and pharmacist-led counseling interventions will improve pharmaceutical care and prescription, also overall health outcomes. Researcher worldwide, regarding my literature review, researcher worldwide noticed the importance of decision making for pharmacists as being the first line healthcare provider and to expand the quality and quantity of services given by pharmacists in terms of decision making in community pharmacy. Regarding the methodology of this study, the researcher designed the study survey using Google form. The researcher employed a multiplicated data collection approach to ensure comprehensive and diverse sample of community pharmacists was obtained. The survey was distributed using popular social media platforms such as Facebook, WhatsApp, in order to reach the largest possible number of community pharmacists. Through targeted distribution among pharmacy-related communities, groups, and pages, the researcher established direct connection with community pharmacists and invited them to participate in the study. After analyzing the collected data, the study revealed the value of pharmaceutical intervention and improved decision-making abilities in improving patient outcomes and pharmaceutical treatment in Jordanian community pharmacies. The collected sample size was 380 registered pharmacists from Jordan population. The total pharmacist population was about 32,727 pharmacists that are registered according to the records of Jordan Pharmaceutical Association, utilizing stratified random sampling to ensure statistical representation. The sampling method was using a stratified random sampling method with a reliable sampling frame and web-based survey approach. The research analysis was using SPSS, descriptive statistics, t-test, regression analysis, and correlation analysis. Regarding the results and discussion of this study, this table 1 resembles the population of the study. The female pharmacist was almost 53% of the population of this study, which is slightly higher number of female pharmacists. According also to the records, there are about 69% of pharmacists in Jordan are females, and this is fair representation of both genders. Regarding the number of years of practicing as a pharmacist, the high number of the most members of pharmacists who about 1 to 5 years experience as a pharmacist. The high number of annual pharmacy graduates due to an increase in pharmacy faculties in number. There is almost 19 faculties in governmental and private universities in Jordan. The results align with the studies by Jarab et al. And Saada et al. Showing similar experience distribution. According to this, also the most age distribution of pharmacists was almost from 20 to 30 years old, which is about 47%. This is also resembles to what was found that show that the majority of respondents were between 20 and 30 years old. This improved the need for professional development and skill enhancement are important for these junior pharmacists. Regarding the type of community pharmacy, we have in Jordan, as I mentioned before, there are chain pharmacies and independent pharmacies. Most of the respondents, about 75.5% were independent pharmacy, and this is show the presence of a high number of independent pharmacy regarding to chain pharmacies. According to Bashiti et al., they found that in Jordan, the number of independent pharmacies is more than chain pharmacies. This resembles independent pharmacies are more prevalent in Jordan comparing to chain or franchise pharmacies. Okay, this table shows the factors that considered when evaluating and choosing therapeutic options for individual patients in community pharmacy. We can find that pharmacists mentioned allergies from the patient or for the patient regarding medication or certain type of food or certain drug-drug interaction that could make allergies with about 91.8%, and this shows the importance of checking out the allergies that the patient may experience. After that, like the potential drug interactions, current medication used by patient, ethical consideration, patient medical history, and the last one with 21%, which was cultural perspectives. Okay, regarding the tools, resources, or guidelines commonly used in decision-making process as pharmacists in community pharmacies, we can find that about 83% of pharmacists use evidence-based guidelines. Also, about 53% of pharmacists use patient information leaflet in order to make decisions regarding the patient clinical state. Also, we can see that there is the minimum use of consultation with other healthcare professionals, which is about 29.6%, and this could be need to be improved. So, regarding balancing patient interests such as their preferences and beliefs with pharmacists' own knowledge and skills when making medication-related decisions, we can see that active listening to the patient is about 93.9% of pharmacists actively listen to their patient, and this improve patient pharmacist relationship in order to improve the decision making process by pharmacists. Also, they pharmacists consult with healthcare team about 46.9%. Ethical consideration, shared decision making with, which is sharing patient in their decision making, documentation, evidence-based practice, cultural sensitivity, and providing clear and unbiased information to patient. And continuing education is also considered an interest for pharmacists. Okay, regarding testing hypothesis of this study, the first one is the impact of pharmacists on pharmaceutical care. It was found that there is a significant impact of pharmacist-led counseling intervention on medication adherence, prescription management, patient care in Jordanian community pharmacies. So we can see that pharmacists who prioritize patient interest increase their ability to make decisions. In order to improve decision-making skills on pharmaceutical care, it was found that there is a significant impact of decision-making skills on medication adherence, prescription management, patient care in Jordanian community pharmacies. This supports the important role of decision-making abilities play in the provision of health care. Regarding decision-making skills effect on health, overall health outcomes, it was found that there is a significant impact. There is no significant impact, sorry, on overall health outcomes in Jordanian community pharmacies. Decision-making abilities in Jordanian community pharmacies have a major impact on health outcomes. Okay, regarding the need for additional training or education on shared decision making, it was found that there is a need for additional training or education on shared decision making to enhance pharmacists' ability to balance patient interests with pharmacist expertise. This supports the inclusion of comprehensive shared decision making training programs in pharmacy education programs and continuing professional development programs. The conclusion of this study that their decision making has an important role in managing pharmaceutical therapy in community pharmacy. There is a positive impact of pharmacist-led counseling interventions on decision making abilities. Pharmacists in Jordanian community pharmacies rely heavily on evidence-based guidelines, patient information leaflet, drug database for decision making. Additional training in shared decision making is important for pharmacists to improve their abilities. And finally, continuous education and professional development are highly considered to improve decision making skills. The recommendation from this study was to customize intervention designed specifically for pharmacists in the early stages of their careers, cultural competence training, improvement of evidence-based practice, and interdisciplinary collaboration between different healthcare providers. Thank you very much.
Thank you. Okay, one moment. Okay, thank you, Soumaiya. Have you finished?
Okay. Yes. Yes, doctor, I finished.
Okay, before giving the floor to Dr. Noha, can you go to the conclusions or the output before the recommendations? Can you show it to me, please? Before, yeah? One moment, yeah? So your conclusions is the result of the SPSS, isn't it?
Yes.
Are your conclusions the result of the SPSS?
Yes, regarding the results of the study.
Okay. Okay, Dr. Noha, floor is yours. Go ahead.
Thank you. Thank you, Professor. Soumaiya, I want you to explain to me in very, excuse me, in very clear words, what are you measuring in your study?
Okay, I measured pharmacist-led interventions that I want to study how the pharmacist can make what is the best way to to provide decision making for pharmacists, and what it can. Yes.
Go ahead.
Okay, and the effect of decision-making skills on overall all health outcomes in Jordanian community pharmacies. The impact of pharmacy.
I don't want you to
Yes.
read. I'm sorry.
Yes.
I'm sorry. I don't want you to read anything. I just want you to tell me exactly what are you studying, what are you measuring in your study, okay? So you
Yes, I
say
measure.
that. Go ahead.
Yes, doctor. Yes, go ahead. Sorry.
No, I want to listen to your answer.
Okay. In this study, mainly, I want to know what are the factors that we can use to measure the best way for decision-making process in pharmacies, in community pharmacies in Jordan. The best ways and the things that affect the decision-making process in community pharmacies in Jordan, and how to improve them.
Did you reach that result? Have you found these factors or elements that affect the
Yes.
decision making in pharmacy care?
Yes. Okay. Okay. These are the factors. The factors considered in order to evaluate the therapeutic options outcomes. Also, these factors will help us in improving the situation as a pharmacist in the pharmacy and how to improve them. And
The
how to
situation
improve in community pharmacy, how to make a decision in a community pharmacy.
Okay, and what are these? Would you explain to us what are the factors that affect the decision making
Yes.
in
Yeah,
public
knowing.
pharmacy practice?
Yes, yes. When the pharmacist interact with the patient in the community pharmacy, he must make a relationship between the pharmacist and the patient in order to reach the best therapeutic outcomes that will improve patient overall health outcomes. So we can see that sometimes some pharmacists make documentations, some pharmacists make relationship between the pharmacist and patient. This will make the pharmacist know what is the best option for the patient in order to give him the best treatment that he needs.
And what do you mean by allergies?
Allergies, sometimes patient has certain allergy for food, for supplements, for certain type of drug, certain type of allergies from, it's a wide range of allergies. Sometimes they have food allergy from certain supplement or presented in the medication. There is some additives in the
Yeah. How
medication.
would
Yes.
that affect? How would that affect the pharmacist's decision of determining
Yes,
the
sure.
prescribed medication?
Sure, if you know that there are some persons has allergy for medication, you must not give him. Like penicillin
Yeah,
allergies.
but it depends. Like I'm not a pharmacist, but I always read those leaflets inside any medication because I have allergies to many things.
Uh-huh.
So it's there. It doesn't have to have any skills or decision making skills. You just read the leaflets.
No, you read it, but sometimes people not do not read it.
Yeah, but it
Yeah,
doesn't need a whole study, PhD study, to determine that allergies would set or determine the type of medication that a patient needs.
I didn't
Anyway,
mention the yes.
yeah, it's not a factor in decision making. Well, you have a problem, Sumaya. I have to be honest with you. This is not considered to be a scientific study. I didn't see anything about decision making in management. This is a management study, okay? You need to explain to us what is decision making, what are the factors that affect, according to the theories, in a scientific way, what determines decision making, okay? Whether in a pharmaceutical sector or in economics or anything. And you focus on the health sector and the pharmaceutical sector, okay? So that's a very important part that is missing from your study. That's one thing. Second is the first impression from your study is that you are trying to replace physicians with pharmacists, because it's not the job of the pharmacist to diagnose the patient and to determine the medication, the proper medication. It's the job of the pharmacist, the physician, right?
No, doctor,
Or
we
why
have
would
a
we need
certain.
physicians?
No, we have no, not that. Okay, no. Sometimes we have certain obstacles. We have to know that maybe the physician didn't notice that with the patient, and we are as a pharmacist, and we have a new studies that clinical pharmacy. They share their work with the physicians also. They have to share. Sometimes there is certain calculations you may have to do as a pharmacist. Sometimes the physician didn't make them. You have to know the drug-drug interactions that could be considered in in the prescription given by the physician. This is this is the job of pharmacist. As I mentioned, certain type of allergies, sometimes the physician will not be aware about. It's the study of pharmacy. It's the job of pharmacists. We are not only giving medication. No, we have a role we have a certain role in giving in the prescription management also.
Which is what? What's
Also,
that?
we in our country, the
دكتور
community
نهى
pharmacist has a great.
سمية دكتور نهى I need to ask a question because there is something missing in my understanding. Now, what are the decisions that you are after, Sumaya? Are you after the decision of the pharmacist to issue the suitable medicine to the patient? This is what you are after? This is a decision that you are after? This is what you call decision making? To issue a suitable medicine for allergic person or for somebody with diarrhea? Or what is the output, the decision
Yes.
that you are after?
Yes, in our country, as you know, pharmacy has a great role. Community pharmacy has a great role
Yeah, Sumaya,
for
Sumaya,
patients that
Sumaya,
never.
stop,
Yes,
Sumaya. Uh,
yes. Okay, okay. I will answer.
my question is yes or no. Are you after the studying the decision that is made by the pharmacist on how to issue the medicine, to give the packet of medicine or tablets to
Not,
somebody?
not,
This is your decision?
not. يعني up to certain limit. Yes, yes. Up to certain limit. Yes. There is some cases the patient don't go to the physician. They came to the community pharmacy since they are close. They are available.
Please, stay in my line. What are other decisions?
Yes.
You said, okay, to some extent. What are other decisions? So that we can continue with you knowing exactly what you need. So far, what I've seen in your dissertation is contradictory to what we have agreed upon in the first place. You are only after the decisions issued by the pharmacist in the day-to-day work, how to issue the medicine and so on. Do you have any other decision that they covered by your study as an output?
To issue and to manage the prescription given by the physician.
Okay.
Even the prescription given by the physician.
Dr. Noha, okay, again, sorry for interrupting. Go ahead, Dr. Noha, sorry.
No, thank you. I would like to thank you, Professor, because this is exactly what I'm going to. Soumaya has a very interesting topic, but what's inside, what she's trying to do inside in the study has nothing to do with it. Okay, it's about decision making in the pharmaceutical sector, and the content of the study has nothing to do with it. Okay, obviously it tries to focus on the importance of pharmacists in treatment, in patient treatment, but this is not how it's done. Okay, the sample that you have chosen, the sample that you've worked on, is totally biased. Asking a physician if he has treated his patient efficiently. This is not an efficient way of measuring the impact. Okay, you measure the impact on the subject itself. Okay, but not the source. So if you are trying to, now that's the point from my first question. Now, in the study, you're saying that you want to measure the significance of the intervention, pharmacist intervention. So you're concluding that there is a significance according to the pharmacists themselves. Okay, of course, I'm a pharmacist. I would say that all my patients went well, recovered, and they had very good treatment, etc. But nothing in the questionnaire, nothing in the well, yeah, that's the point. You're trying to measure decision making, but the questionnaire is completely directed into the efficiency of the treatment. Okay, so you're not asking the pharmacists what are the elements or factors that affect their decision making. Now, the first factor should be the physicians themselves, the prescriptions. Okay, because sometimes you get a prescription from a physician, excuse me, from a physician, but it wouldn't satisfy you as a patient. This is when you would seek the consultancy of a trained or expert pharmacist, because it didn't work with you. The medication that the physician prescribed to you didn't work with you as a patient. This is when you would seek somebody else's help, whether another physician or a pharmacist in that case. This happens after visiting the physician. You're not trying to replace physicians. Okay, the impression from your study is that focusing on the role of pharmacists in the health sector in a very biased way, in a way that shows that they are the ones that make decisions in determining the medications, which is not, it's not acceptable, and it's not it's not true. Okay, they cannot diagnose the disease. Okay, and that's what you have mentioned here. Excuse me. Yeah, on page 20. You have a reference for Ibrahim et al. 2018. Pharmacies are considered highly accessible, and pharmacists' advice is well trusted before visiting a physician.
Yes. As I mentioned before, in Jordan, mainly in Jordan, the patients went to pharmacies sometimes before going to the patient, sorry, to the physician. In case if the pharmacist couldn't diagnose the patient, or the case is very difficult, he asked him to go to the physician. Sometimes certain type of illnesses will not need to go to the physician. The pharmacist can, it's not about diagnosis. We have different rules other than, sorry, other than giving medication. It's not only giving medication.
What are these rules? When would a physician, a pharmacist, give a decision that would get the patient to forget about visiting the therapist or the physician? In what cases? What kinds of diseases?
Certain type, as I mentioned before, certain type of over-the-counter drugs, certain type of supplements, certain type of, as I said, medication, drug-drug interaction, or certain type, as sometimes I know that the patient has certain type of allergy or drug-drug interaction. I can consider that as and mention that certain type of cough.
Okay.
Yes.
Soumaiya, do you think that this study, the recommendations and the results from your study, needs a PhD research? This is a PhD research. Okay, it has to be intensive. It has to have a very well prepared process in getting a valuable outcome. Okay, not some outcome that you will get from just visiting the pharmacies. Okay, you're trying to study decision making in pharmacies, what affects the pharmacist's decision of prescribing a medication. That's a whole different study. Okay, that's a whole different scope. Very different than what you've done in your study.
But,
okay?
but actually, in my study, I
Electronic
studied
medication record systems has nothing to do with the decision making.
Sorry,
I don't know what your references are. There is a whole lot of comments you will find on your literature review, because it has nothing to do with literature review. The content of your literature review chapter has nothing to do with literature review. Okay? So you have to redo the whole thing. I'm sorry, this is not a PhD dissertation. Okay? And I will leave the comments for you in my on your document, but the whole sample is not doesn't satisfy the objective of your study. The questionnaire, the whole thing, you need to redo the whole thing based on your understanding of decision making as an important factor in determining the quality of pharmaceutical services provided. That's how it should be, okay? So you're assessing a service done by pharmacists. This should be done in a whole different way. If you think that decision making is an important element or factor that affects the quality of this service, then you need to understand what decision making process is and how it would affect the impact of the service itself. There are it's supposed to be a management study, but it has nothing to do with management. It's very unorganized. You feel lost. I tried many times to understand what you're trying to measure, how you're trying to do that, but I couldn't. It's totally messed up. The title is very interesting. You need to focus on your title and how to do it. You need to redo the whole thing. You need to read again, go through the literature review, how people done it. You have very good studies mentioned in your literature review, but you didn't take the objective of mentioning the literature review there by learning from those studies what they have done and what they have recommended for other researchers. Okay, like you have the methodology out there for you, you have the process, but you didn't follow it. Okay. Well, Professor Zahir, the comments are there in my the file I will send you. I hope I've made myself clear here.
Okay, thank you, Dr. Naha. Thank you very much. The comments you put is the comments are very, very valuable, but let us see what is the feedback of and the questions from Dr. Asim. Dr. Asim?
Okay. Good morning. Assalamu alaikum, everyone. Right. I mean, as usual, I like to start from the title, and again ask the question in a different way, same as what Dr. Nuha said. You know, the point about decision making. How do you interpret decision making? What do you mean by decision making, Soumaiya?
Okay, decision making in clinical pharmacy is how to make the proper decision regarding the medication that I want to give to the patient after seeing the prescription, whole prescription, after asking the patient about his status, his medical status, if he has certain type of allergy, if he has certain type of clinical disorders that may affect or may be affected by the medication itself. Certain type of people, they have kidney diseases or liver disease. By that, by knowing that terms, I will work on giving him the proper medication that will fit him by consult with the healthcare professional about that. The decision making in pharmacy, it's assessing and selecting the best therapy choices for each patient according, as I said, to their certain requirements and traits that present that I know as a pharmacist in order to evaluate the best models for the patient.
Okay. Now, under the regulations,
Yes.
do pharmacists have the power to change a medication?
Actually, yes, I can consult the medication, the healthcare professional, the physician, and yes, I have the rule. Also, yes.
No, sorry. No, without consultation. I'm saying under the regulations, do pharmacists have the power to change? I go to the pharmacist with a prescription, right? And they say to me, "Oh no, you cannot take this medicine. You have to take another one, a different one completely." Can they actually remove and replace a medication for a patient?
Actually, yes. If there is a certain cause that I must not give the patient this medication, yes, I can. Also, I can also in terms of
I understand.
yeah,
Then the action should be go back to your you say to the patient, for instance, go back to the
to the physician.
physician,
Yes,
yeah,
yes,
and say, well, this is, they say this is not the proper one, blah, blah, something like this. But
yes.
can you change the medication?
Change it, no, but I can stop the giving the medication. I can avoid to give him the medication if I don't want to give. If there is a certain circumstances that I should not give him the medication, yes, I will not give him.
Okay.
Changing the medication depends on the as I mentioned before, the patient himself. Sometimes I can ask the patient, this medication is something you don't have to do or to use it.
What does the regulation say about this specifically? You know, I remember asking you for this before, going into the regulation and bringing the information or clauses from the regulation about the role of the pharmacist and what they can do, what they cannot do, and so on. What does the regulations say about the role of the pharmacist in a situation like this?
Okay, I didn't write the rule exactly, but as I mentioned before, if you see that the patient, or if you consider this medication will be considered harmful for the patient, you can avoid giving him.
Yeah, but look,
Yes,
Sumaya, you are,
there is certain types of medication.
yeah,
Certain type of medication are not given to the pregnant. For example, okay, if
yeah,
the
but this is,
physician write, yes, if the physician write for me this medication, I will not give it to the pregnant woman. For example, certain medication are not given for children. I will avoid giving that to the children, even if it was written by the physician himself. Physician himself.
yeah, but what does the where are the regulator here? Where is the regulator and what are the regulations? What do they
Yes.
say?
Uh, I will check them and write them in the comments.
Yeah, but
Okay. I
you
will.
see,
Yeah.
this is anything to do with medicine, with medical, with healthcare, is highly regulated. You know,
Yes.
and
Yes.
in a research like this, the first thing should be considered is what the regulator says, what are their conditions, the role of the pharmacist, what they are allowed, what they are not allowed, how, because you see, even you say, okay, if I receive something, a prescription from, I will not give the medicine. Fine, that's okay.
Okay. I
But
will
is
give you an
is this?
example.
Excuse me. Let,
Yes.
let me finish. Is this
Okay.
is this how the regulation puts it? You know, they say, for instance, you are allowed to advise against it. You ask the patient to go back to the physician, something like this. It's,
Yes.
you know, yeah, because
Okay. You
here
can.
the way it's appearing is that the physician does not know what he or she is doing. Their knowledge of drugs or the medicine is shallow or something like this, or they know nothing about it. I mean, is this the case?
Yes, in certain, okay, I will give you an example that I already know. The narcotics and medication that affect the maintenance of health, brain health, they are prohibited even only by giving a certain type of prescription, which is called وصفة أمنية. This is by the law of narcotics. So I will not give any patient such as tramadol or this type of narcotics without this type of prescription, which is prohibited only by certain type of which is has a serial number. And I will not give the patient, even if he came for me with a medication prescription from a physician, I will not give him any medication without the presence of this what is called وصفة أمنية. This is an example for narcotic medication.
Okay. Yeah, but okay, that's based on the regulation, which is fine. That's good. We need to know that. Now, okay, on another issue, who participated in answering your survey, your questionnaire?
Pharmacists and community pharmacists.
Only the pharmacists.
Yes.
I mean, who are, in your opinion, who are the stakeholders for this study?
I think, from my opinion, stakeholders will be the Jordan Pharmaceutical Association and the pharmacy doctors and pharmacy colleagues, in order to improve the decision-making process as education.
And how about the physicians?
Actually, I didn't mention them in certain type of my study, since according to previous study, I didn't see any of that studies ask the opinion of physicians. Actually, the studies were done almost on pharmacists only. And that's why I think that I will make that in
And what about the people themselves, the patients?
yes,
Aren't they,
I suppose that the next step will be the physicians and the patients themselves.
yeah, but because this is about decision making, and is the decision, um, of course, the decision is taken in the pharmacy by the pharmacist, but this is a study. I want to see the impact of this decision on people, the impact of a decision on the physician themselves, physicians on the community, and things like this. So why didn't you involve these people as well in the study? Because it's about decision making. And is it only the decision of the pharmacist, or also it's a decision of the patient and the
Yes, we have
other
certain
people?
studies. There are certain studies about patient certain centered اللي هي centered in decision making. This is another type of studies. It's patient centering, and to ensure to avoid and give the pharmacist the patient the role in decision making about his medication. And this was asked about by the pharmacist themselves. As I said, there is in the questions here, we can see that the patient has certain rules in the factors that considers when evaluating and choosing therapeutic options. So we can see that the patient medical history, patient treatment goals, patient education, patient refusal, patient preferences. Sometimes they have certain preferences. They prefer let's say a type of medication that is cheaper than other medication. This is what I mentioned. So we can for sure we can add and ensure the presence of patient as a decision maker here. But
Now,
according to my study, actually, only regarding the factors that given by pharmacists.
yeah. Anyway, I think the literature review you presented is very short. I mean, 10 pages of literature review is not, I think, does not give justice to the topic. The other thing is, Do you think that pharmacists with 5 years experience or less are capable of making such decisions? Because they are the majority.
Actually, I don't think so. That they have to do more presentation, more presenting for the decision making process. They have to detail themselves much more. But actually, the high number of these. Low minimum experience is due to the high number of graduates from faculties of pharmacy all over Jordan.
But how would that affect your findings?
Yes, the findings of my study they found that they need more training. That's how did that affect my study. They need more training in order to improve their decision-making skills.
You mentioned in your presentation you were measuring active listening, or you are talking about active listening. How did you
Yes.
measure active listening?
Okay, this is, as I mentioned, it's the viewpoint of the pharmacist himself, but actually, yes, by the pharmacist himself, not by
How did you measure?
um, it's as mentioned by pharmacists. They use the active. Most of the pharmacists, 93%, says that active listening to the patient will help them in making decisions. But I didn't measure that actually. It's the response of
Yeah,
pharmacists.
yeah. I mean, they will say that. How do I know that they are doing active listening or not?
Maybe this
You
could be
see,
if
this is
it's an open,
that's my
it's
point.
an
You know,
open.
I should ask the patient. Did they actually actively listen to you? You know, things like this. That's why you should bring
Uh-huh.
other
Yes,
variables
I
into
think
the.
yes. It's from the viewpoint. Could be from the viewpoint of the patient himself.
Yeah, look, again, back to the issue of decision making. What are the variables or the factors that affect? I know you mentioned the factors affecting decision making, but what are the dimensions of decision making in this particular topic?
Okay, it's how to deal with with the patient in terms of his preferences, his medication status, his previous illnesses. If I documented any medication, previous medication for him. Um, any ethical consideration could be sometimes we have to do ethics with the patient. Sometimes a patient come to you, he want to ask you about something he don't want to mention to in front of others. Sometimes you can you will be working with a patient that his education is not so much high, so you have to take all of these things into consideration when making any consultation for the pharmacist. The consultation for the patient, I think it's the most important and the most important service that the pharmacist goes to the patient.
Okay, I'm done. Thank you very much.
Okay, thank you, doctor.
Okay, thank you, Dr. Asim. Thank you, Dr. Noha. You see, the one thing that I'm not sure about, I did not find the decision that we need to search. We need to make a research on what decision. A decision by a pharmacist to give the medicine, to hand the medicine to the patient. This is not a decision. Secondly, you are talking to somebody who must not have a decision. The decision is in the hand of the physician. If we accept this as a decision, I do not accept it yet. I feel that in due course, maybe in this discussion, we will reach We reach a decision, and what decision we need to consider. So the decision is not in the hand of the pharmacist, it is in the hand of the physician. In table 6 and in table 7, you put lots of environment around the decision, but all of them I don't think has anything to do with the decision of the pharmacist. Go back to table number 6, please. Yeah? So how on earth a pharmacist would issue the medicine or give it to the patient when it comes to evidence-based guidelines? I would say this would go for the physician to decide which medicine is suitable for the patient. Then consultation with other health professionals. Whenever there is a prescription received by the pharmacist, all what he has to do is to issue the medicine, to give it to the patient. So what is the relationship between that decision and consultation with other health professionals? Would he tell the patient, wait, I need to consult those people, healthcare professionals, come back in 20 days and they'll give you the feedback? He will hand it, once he sees the prescription, he would handle the medicine. Can you explain this please to me?
Yes, doctor. Actually, as a pharmacist, I know that in certain types, as I mentioned before, certain type of prescription we can see. For example, the patient didn't mention to the physician that he has penicillin allergies, but he told me that, or I asked him about that. So I will consult the the healthcare provider that the patient has a penicillin allergy or certain type of medication that are not given to the pregnant. Sometimes they forget to tell the physician that they are pregnant. So I have to consult them.
What you are saying comes under treatment process, not decision making. Decision making in management, it's a totally different issue, different than the process of issuing medicine or a treatment process. Treatment process means that you have to diagnose the patient, counseling with others, and then come back and give the proper decision, the proper treatment, I would say. So we need to do something in your work that would highlight some decisions as an outcome of your research. It is not only, because when you said training, the training is very important for the pharmacist. Can you tell me how the training would enhance their decision-making capabilities?
Yes, by using now we have a certain type of according to the records to the Jordan Pharmaceutical Association, all the pharmacists have to work on 25 hours CPD hours every 5 years in order to improve their pharmacist their skills as a pharmacist. They have to go to scientific days or المؤتمرات العلمية scientific okay, and they have to go to certain type of lectures in order also to improve.
After this training, they will be physicians. Those pharmacists?
No, no, this will improve.
So
this will improve.
Soumaiya. Whenever you are asked a question, you start answering without concentrating on the question. When you say that they have to have the training, it has nothing to do with the output that you are after. It has nothing to do with the treatment prescribed by the physician, by the doctor himself or herself. So when you say training, it has nothing to do with the pharmacist in this area. They have nothing to do with the prescription. It is not their damn business. They are not allowed to intervene or to interfere. They are not allowed under all the laws of the world to issue antibiotics even. They are not allowed. So at the end of the day, you are discussing an issue, a decision that is not a decision. It's a treatment process, and that has nothing to do with management lines in the doctorate. I would give some suggestions so that you convert your treatment process into decision making. It's tough, and I need Dr. Noha and Dr. Asim to help me in this. Otherwise, we cannot accept your work. The first thing is, in order to work on the decisions, we have to specify some decisions that are related to the side of the management itself, the process of receiving, I would say, of involving the pharmacists in the decision. This could mean that we need the pharmacist to be aware of the software used, so that when at least we have to start with what are the capabilities or the authority of the pharmacist in his work or in her work. Depending on that, we will cast decisions. Part of it will be managerial, part of it will be on the quality control of the work itself, whether it is in the pharmacy itself. I recall in the UK, in any pharmacy, they have what they call quality control inside the pharmacy. Quality control means that the pharmacy itself has so many, I would say, stages in reviewing the prescriptions, so many steps in issuing or mixing or designing the drug, because they are allowed to cast and to design, to manufacture the drug inside some of the pharmacies. So they have a quality control, they have a process, they have financial system attached to it, they have customer care attached to it. So if you want to have a decision in a pharmacy, you should not talk about something that is not in the hand of the pharmacist. In the pharmacist, we have a pharmacy, we have a work, day-to-day work. So you should go for the quality control at the pharmacy. You should go for the okay, double check, no problem, regarding the whole issues mentioned in table 6. Why not? Then we should go also for the actual managerial skills that need to be with the pharmacist. And when we say pharmacist, are we talking about the pharmacy as a whole, or the pharmacist as individual? If you want to talk about the pharmacist as individual, I think this will not work. You will not find a way to make this as a doctorate, I would say, dissertation. No, it will not, in my opinion. You talk about the pharmacist and the environment of the pharmacist, which is the pharmacy itself, and the process inside.
Yes,
the
community pharmacy.
Now, once we have this, we have to go back to the process of the logistics needed for this pharmacy, and how we have the decisions of those logistics. What are these logistics? So at the end of the day, I mean, you have very nice items. Go to table number, one moment, number 7 or 8, 7.
Yes, here is 7.
One moment. Okay, I'll go for the first, as Dr. Asim said, active listening to the patient. I mean, do you think this is a valid one? It's not a valid one. Why should we listen to the patient? We have the person who listened to the patient was the physician. The pharmacist has nothing to do in his study to listen to the patient, unless he has specific issues, like you said, the allergic. Okay, allergic to some medicine is something different. Even this should have been asked by the physician himself before issuing a penicillin or whatever. Ethical considerations has nothing to do with your work. What do you mean by ethical? If you want to talk about ethical consideration, what is the relation between ethical consideration and issuing a piece of medicine? What is the relationship? So we have a problem here in the research mentality. Research mentality means that you have to have decisions very clear. We don't have clear decisions, and in your research questions you have repeated two different items that has when you say the effect on the health outcome in Jordan. What a very serious declaration. How on earth this would affect the outcome of the health in Jordan? How did you measure it? You said, okay, this has an effect on it, and you put this in your problem statement, you put this in your research question, and then you said this will affect the health in Jordan. What is the impact of, this is one of your research questions. Number 3, what is the impact of decision-making skills on medication adherence, prescription management, patient care in Jordanian community pharmacies? Okay, what impact the same in on over health outcomes? This is number 4. So how did you measure the impact on the overall health outcomes in Jordan? This is very serious, declaration, very serious, but you did not have anything to do in your conclusion. You did not touch this, you did not measure it, you did not put it in the research. Okay, it's good to say that what will be the outcome on the health, but give me what parameters are you measuring to do this? And by itself, this is alone by itself is a separate research. But it was, although it is a research question, you did not have a conclusion or an answer to this at the end. It was very general. Unless you have an answer for this. Did you cover that question, number 4? Did you answer this question? Let me see how you think.
Actually, the overall health outcomes, as I said here, the question was about medication adherence and overall health outcomes. The pharmacist also has a role
we have
about
again,
active
again, Soumaiya.
Yes.
Okay, when you finish your doctorate, nobody will say this to you, but I'm saying it, and be careful. Listen carefully. The best thing about research mentality and doctor mentality is the organized way of thinking. So far, you did not give us an organized way of thinking. I told you twice, when you are asked a question, think of it and answer it. My question was very clear, and then you swim in another field, another area. Wait, what I've asked is, can you show me in your doctorate, how did you measure the outcome on health in Jordan? Then you started talking about something has nothing to do with what I've talked. Understand the question and then answer it. My question, how did you measure the health outcome in Jordan according to your research? And don't talk don't say anything that has nothing to do with my question. Can you do this?
Okay. Actually, I only asked the pharmacist about their how they can answer. So I can't give you the answer of the patient.
So you did not
actually.
You did not answer. You put a research question. Look, whenever I keep saying this to my students, and I've told you several times. Whenever I read any PhD or doctorate research, I start doing like this. I'll take the first part and the final part, and I leave in the middle. This is the first. I'll see the research questions. Soumaiya, look at me. Yes. I'll see the first part. There is 4 research questions and the problem statement and objectives. Then I leave everything and they go to the end. Have they answered the research question? Did they solve the problem? Have they fulfilled the objectives? If not, what's the need? Why should I continue? You did not do this. Thank you. You should look at the work as a series, a story, a start. Okay, you take supplementary in the middle, and then you go to the medication, the outcome of your medication, which is the fruit, the conclusions, the answer to your question of the research. Okay, do you want to add something, Dr. Nuha? Dr. Asim? Dr. Nuha?
Yes, if you would excuse me for a second, I just want to advise Soumaiya to go through the pharmaceutical research or the research done on the pharmaceutical sectors in other countries, go through the statistics about the best quality provided in the pharmaceutical sector in other countries, get a role model and see if decision making has a role in that, in that quality, in that high quality provided in the pharmaceutical sector, and then apply it to the Jordanian case. Okay, she needs a role model. She needs to know what's going on in other countries in order to a, find the factors that would lead the pharmaceutical sector in Jordan to reach the level of high quality in other countries. I think this is the best way to do it. If they have a freedom in decision making, what kind of freedom, what kind of decision they have to do, and if this is an important factor in the quality provided in that sector in other countries, then she would try to apply it to Jordan and test if it applies or not in the Jordanian case. How to reach that level of quality in other countries. I think that would be a good start for her, just to learn how things are going in other countries.
Okay. Okay.
Dr. Asim?
Yes, thanks. One point, you mentioned the training that should be conducted or maybe has been conducted. My question is, what is the nature of that training and whereabout it has been conducted?
Okay, according to the Jordan Pharmaceutical Association, as I said, and the Medical Consult Board, we have to, pharmacists have to take about 25 CPD hours every 5 years in order to renovate the permission of working as a pharmacist. So we in Jordan, there are many conferences, lectures given by even physicians or pharmacists, certain drugstores, in the university faculties of pharmacies in Jordanian universities. Even as I said, drugstores, they give lectures about their medication that they give them in the markets as new medications, or if there is any new trends used for their medication, in order to improve the knowledge of pharmacists about the medication and the ways how to they deal with with these type of medications.
But my question is, what is the nature? Tell me about in relation to this, in relation to the research, to the topic, to decision making. How do they? What kind of training that is going to help improve decision making with related to pharmacy?
Okay, I will say it again. Actually, in Jordan, the pharmacist has a great role in giving over-the-counter medication. Not an,
Soumaiya,
yes,
sorry.
yes.
Give me titles. Give me, and these titles in relation to your research. This has happened in X country, and so on. Something like this. Just something to, not in general. I understand the issue of CPDs and things like this, but I'm talking about specific training. We are talking about.
Okay, I don't now. I can't hold a certain name, but as I said, for example, certain drugstores, when they give okay, when they have a new product in the pharmacies or in the field, they give. They give information about that by using by lectures or scientific day, in order to show the pharmacists what are the new this is about the new generation of the medication they provide. For example, It's just an example. In the medical or in the pharmaceutical conferences, there are many pharmacy doctors talking about the medications, the pharmacy administration, how to improve pharmacy administration as a pharmacist. Actually, I don't know how to give you a certain name for that, but they are occurred many times a year.
I think you should have a whole section about this in the literature review, because this is your, I mean, you have reached a conclusion about it, right? And I think you should have included some suggestions during your survey. But anyway, there should be a whole section on this in the literature review. I'm done. Thank you.
Okay, thank you. I'll do something that yeah, in some universities they do it, but I feel that this time I need to do it. We have all the audience here are doctorate audience. Maybe 95%, I'm not sure. So I would like to ask one of our students who has their work in the medical field to put forward a question from their side. What will be the best question from your side to your colleague, Soumaiya? Again, my question to the audience, to our doctorate students who are attending in the field of, in the medical field, whether it is pharmacists or healthcare, whatever. What is your question to Soumaiya that you need to know, or you need us to know, to enlighten us? Anybody? Our students, doctorate students. You don't have the gut to ask?
وصيتهم دكتور.
Okay.
She had enough questions.
Sorry, مين بيسأل؟ حسني. Go ahead, Husni.
حسني. بحكي she had enough questions today. We wish her all the best, inshallah.
No. Thank you. Your participation with us has no value. Thank you very much. Because we asked somebody to ask.
Thank you.
Not to comment. Thank you. Okay. Now, thank you very much, Soumaiya. Let us convene now. We finished our deliberation, our discussion, our viva, and we'll see how it goes. We'll go away for say 5 or 10 minutes, 20 minutes, Allahu Alam, and then we'll come back to you. Thank you. Assalamu alaikum.